Okay, so while we were having our conversation, obviously new things, come to light, and I asked Helen if we can record a little extra of what she mentioned about, grinding at night. And
yeah, it was. I was just saying that my partner had said the other day, I think because I've got a cold, he said, "Oh, just to let you know, I noticed just for a minute you were kind of doing that," and I've obviously never heard myself grind my teeth, so I was like, "Can you, explain a bit more?" And he said, well, compared to what you used to do, and he would be asleep in one room and I could be asleep in another, and he described it as the scariest noise he'd ever heard, because he could literally hear it in a different room, and he said, I don't know how your teeth managed to survive without being smashed to pieces, so then to translate that and think, well, no wonder I was waking up like a tree. If you're doing that all night, you're going to feel terrible, So yeah, that is gone. Yes, there was one moment where I was kind of doing that, but compared to what I was experiencing, I just think
that's fabulous.
Okay,
that, guys, explains that that it just confirms that the trigger to clench is to keep you breathing, to lift the tongue so the air can pass behind it to your lungs, so body will prioritize it. But the mechanical damage of the teeth is really secondary, because we want you to stay alive. And that has improved. Great. And you've also mentioned, having a few splint therapies and being very nervous about having our treatment. Please tell me about it.
Yeah, I mean, I tried, the first splint I was given was like a rubber guard, which is great for protecting the teeth, but all it did for me was like something to bite down on, a bit like a horse's bite almost. So it made it worse, it made the tension worse.
Because the soft guards, they can occupy the tongue space quite significantly. They are chunky.
Yes.
And they can push the tongue into the airway even more. So in 30% of cases, it can make things worse.
Right.
The soft ones. And they can also encourage a bit of chew and play.
Yeah.
So that wasn't great. And then you had another one.
I had, he described, it was like a hard acrylic bottom. MAD, I think he described it as, which I think would have been good, but because I didn't have the support of the back teeth, my jaw would fall back anyway, so had there been that support it might have been useful, but so really with splints I found them a no-go really, and as I was just saying to you, this actually, I mean, I cancelled my appointment with Kalina when it came to the treatment because I was absolutely terrified. I was terrified of I just think the fact I've been dealing with this for quite some time, I just felt really scared of the whole thing. Not even
the unknown,
about making it worse, but just having to have something new in my mouth. And I'm just really pleased that I went for it. I'm really pleased. And it's 3 weeks in, and I've basically got a completely new bite and new teeth, and it's going really well. So I'm really pleased. Thank you, Kalina.
Thank you so much for that feedback, and it's totally understandable. We are installing something permanent, and after suffering so much for so many years, of course, you're nervous. Is it the right thing? Is it going to bring more suffering to me? And we kind of don't have choice sometimes. Me as well. I'm working with my best intentions. I hope I will not bring anything worse to you. All that research and understanding, creating more room for the tongue with decompression of the joints in a muscular comfort. You can't really harm the patient. However, of course, we're both, hoping everything will be fine, and it is. And I'm really, really pleased, because that's another case. And I must tell you guys, none of the patients got worse.
No, and you mentioned that to me.
Yes.
And I think you're also saying, Helen, you need this because you're not old. Made me really think, well, I probably do need this. I've been doing this damage for so long that So
it did help.
It's positive, yes.
Fabulous. Thank you, my love.
That's quite all right.
Yes, and enjoy your holidays. Thank you.
Bye-bye.